So when we do breast augmentation, we make a pocket for an implant, and people always kind of wonder what a pocket really means. Well, there's two pockets for an implant to go in. There's over the muscle placement, so under the breast tissue but over the chest wall and over the muscles, and then under the muscle placement, where we put the implant under the pectoralis major muscle. And the reason we would go under the muscle here is if a woman is really skinny, really flat, skin isn't necessarily good enough to hide the bag. You don't want to see the edges through thin skin, which is called rippling, and it's not really attractive. So we put an implant under the chest muscles, which can hide and support the bag. But in order to be a candidate for that, the breast needs to be fairly high because the pectoralis major muscle is high. And so the breast can't be saggy. It needs to be fairly high on the chest, and then it pushes everything forward and it looks really beautiful. If a breast is fuller, if it's a lower on the chest, or if it's even a little bit saggy, this pocket doesn't work very well because the tissue gets pushed forward and can sag off the end of it. So that's when we go over the muscle. So the tissue should be thick and toned. If it's a little bit lower, it'll fill out and perk up the breast. And so when we put it over the muscle, you can see it's over your muscles but behind the breast tissue. And another term for that is also called subfascial, where there's this thin little skin over the muscle that we can put it under, which is important as well, just to kind of protect that implant and support it. But yeah, so the pockets basically mean the space that we put the implant in, again, whether it's over or under the muscle. So that's what that all means.